Malaria not only kills, but it is one of the most debilitating conditions that you can suffer. When an adult or a child is suffering from malaria, they are totally incapacitated. Now we have about 200 million Africans who suffer from malaria every year. Now during that period, when they are suffering from malaria, at a time during the year when they are supposed to be producing goods and services, and the bulk of the rural community in Africa relies on agriculture for subsistence. And malaria strikes at the time when they are supposed to be plowing, when they are planting their crops. So the huge reduction that we see in agricultural productivity in Africa at the moment is due to malaria. It is a major contributor to the huge amount of stunting of children and the lack of cognitive development of the child, which is absolutely fundamental to education and skills development that we see on the African continent. And just the resources, the household expenditure on malaria amongst rural communities who do not have resources, out-of-pocket expenditure is extremely high. Most of the malaria endemic countries will be able to give you figures where 60% of the spending on health in any family is on malaria. So it is absolutely important for us to realize that some of these major diseases that create a huge disease burden on the continent are not just a threat to health, but they're a threat to economic growth and development. Now, I saw the opportunity to work in malaria as an opportunity to actually save resources, save lives, increase productivity, increase learning outcomes for children, and promote economic growth. But another strength of ALMA is that it is an initiative that has been created by African heads of state and government. It is an opportunity for the African heads of state and government to demonstrate results in the global health area. But it is also an opportunity for us to be able to work with the African, as a global development community, to work with African heads of state and government to ensure that these gains are not just limited to malaria. The ALMA initiative has introduced an accountability mechanism, a scorecard, that records progress in terms of outcomes and in terms of impact, but also progress in terms of the number of process indicators that are showing progress. Now, this scorecard is enabling us to clearly demonstrate the linkages between malaria and HIV/AIDS, between malaria and nutrition, between malaria and the expanded program on immunization, between malaria and community health care. How are we demonstrating this? We are demonstrating that what all of these programs are trying to do is to save a child's life. So when we say to a head of state, because you have rolled out a long-lasting insecticide-treated net to every household in your country, and there is universal coverage with ACTs and RDTs, you have actually reduced under 5 mortality by 40%, we can say, where is the other 60%? You still need to do the same thing for PMTCT. You still need to do the same thing for undernutrition. You still need to do the same thing for immunization. So it's a wonderful opportunity for the heads of state to link these disease areas and to give a face to the malaria challenge. Because the malaria challenge has got a human face. This is the human face of a child, of a mother. And it is the face of development, the future of the continent. This is the face that ALMA is putting on malaria. And it's a unique opportunity because we have not done that in any other area of global health. Being able to link these areas around a central point and give the attention of the heads of state to health in this manner. So I see this as a golden opportunity to contribute to development in Africa, so which is why I am supporting our heads of state in this important initiative.
Great.
The American taxpayer through USAID has been a major contributor to global development as a whole. They've been a major contributor to various aspects of development on the African continent. And in fact, I should say that over the past 10 years, they have been the major contributor to the global health and development initiatives on the African continent. Now, I equate the accountability of all the stakeholders that are working on malaria on the ground in Africa, the accountability to the mother and child, to the accountability that they have to the taxpayer, the American taxpayer, who is also helping to save the lives of these children and improve the quality of life of mothers and communities. It's an important role, and it's a major contributor to global development. And I would say that it speaks to the basic principles that I think define the America as we understand it in the developing world. We see America as a beacon of freedom, of democracy, of development, of giving opportunities, equal opportunities to all. And this is translated, I feel, in the development assistance that is being given to a mother in the rural areas who is earning 50 cents per day through running a little garden project where she sells her little vegetables in the market every single day. When she is faced with a child who is running a high fever and she has got no medicines to give the child, she has no indication of what the cause of this high fever is. Is it malaria? Is it pneumonia? What is it? She doesn't know. But when she is able to go to a health facility and find that there is an RDT, the child can be tested, and if found to have malaria, is given an ACT. If found not to have malaria, is given an antibiotic. She can use that 50 cents. If she gets this service free, she can use that 50 cents to make sure that child gets good nutrition and that child then goes to school. If she doesn't, what does she use that 50 cents to do? She goes to the black market, buys counterfeit drugs, some of them made of chalk, gives them to this child, and the child dies. So what does she lose? She loses a child. She loses income that she could have fed her family on. And she loses the time that she could actually have been working to feed the other children, because now she is mourning for the death of a baby. You multiply that by 10 million, by 20 million, by 100 million. And what does it translate to? It translates into huge reduction in gross domestic product, in the quality of life of people. It translates into children who are uneducated, who reach their adult years without employment, who then become dissatisfied, and they invest in crime, their energies in crime, and in political discontent. And what do you get? Civil war. You get strife. You get more disease and suffering, and they're caught in a vicious cycle. What the American taxpayer is doing is breaking the cycle, is giving a future to Africa. It is marketing their own principles of democracy, of freedom, of development for every individual in the world. And as partners of the American people who are making this huge contribution to development in Africa, we are extremely grateful.